The topic of the tutorial is face, and I, Dr. Alpana Kesar, will be covering this topic under the following subheads: muscles of the face, nerve supply of the face, that is both motor and sensory nerve supply of the face, arterial supply and venous drainage will be covered under the blood supply, and lymphatic drainage of the face, followed by applied anatomy. Muscles of the face. Muscles of the face are also known as muscles of facial expression, but facial expression is not the primary function of the muscles of the face. The primary function of the muscles of the face is to regulate the three openings on the face, that is, the orbital opening, nasal opening, and the oral opening, which means it helps in movement of the eyelids and the lips. Muscles of the face is also considered as a remnant of panniculus carnosus. Panniculus carnosus is a continuous sheet of muscle inserted in the skin as seen in cows and horses, because of which they are able to twitch an area of skin on the back, which humans can't do, except in the face where they are able to partially perform this action, that is movement of the skin of the face. And that is why the muscles of face are also considered as a remnant of panniculus carnosus. Muscles of the face are derived from the mesoderm of the second pharyngeal arch. Six such pharyngeal arches appear in the region of the neck in the developing embryo that gives rise to all the structures in the region of head and neck. The muscles of the face are derived from the mesoderm of the second pharyngeal arch. The nerve of the second pharyngeal arch is facial nerve, thus all the muscles of the face are supplied by the facial nerve. Enumerating the muscles of the face, orbital group of muscles or muscles of the eyelid. This includes orbicularis oculi, corrugator supercilii, levator palpebrae superioris. Muscles of the lips, orbicularis oris, buccinator, levator anguli oris, levator labii superioris, levator labii superioris alecinezi, zygomaticus major, zygomaticus minor, depressor anguli oris, depressor labii inferioris, mentalis, and risorius. Muscles of the nose include procerus, transverse part of nasalis muscle also known as compressor nares, alar part of nasalis muscle also known as dilator nares, and depressor septi. Auricular group of muscles or the muscles of the ear, which include anterior, superior, and posterior auricularis. Muscles of the scalp include frontal belly of occipitofrontalis muscle, also known as frontalis muscle. Muscle of the neck, which includes platysma. We shall do all the muscles of the face in detail, starting with the orbital group of facial muscles, orbicularis oculi. Orbicularis oculi muscle has three parts: the palpebral part, the orbital part, and the lacrimal part. The palpebral part is that part which is confined to the eyelids. Orbital part is the outer part which runs uninterrupted, forming an ellipse around the orbit. And the lacrimal part is present posterior to the lacrimal sac. The palpebral part takes origin from the medial palpebral ligament and gets inserted into the lateral palpebral raphe. The orbital part takes origin from the nasal part of the frontal bone, from the frontal process of maxilla, and from the medial palpebral ligament. The fibers run uninterrupted, forming an ellipse around the orbit. When the orbicularis oculi muscle contracts, it helps in closure of the eyes. The palpebral part of orbicularis oculi helps in gentle closure of the eyelids as in blinking, and the orbital part helps in tight closure of the eyes as when air or dust blows into the eyes. The lacrimal part of orbicularis oculi takes origin from the posterior lacrimal crest and lacrimal fascia and get inserted into the lateral palpebral raphe. When the muscle contracts, it dilates the lacrimal sac and thus helps in sucking the lacrimal fluid from the conjunctival sac into the lacrimal sac. The nerve supply of all the three parts of orbicularis oculi is by branches of facial nerve. Corrugator supercilii. This muscle is corrugator supercilii. Origin of corrugator supercilii is from the medial end of the superciliary arches. Superciliary arches are arched elevations present just superior to the superior orbital margin. After taking origin from the medial end of the superciliary arches, insertion is in the skin of the eyebrows. When the muscle contracts, it draws the skin of the eyebrows medially, thus producing vertical wrinkles on the forehead. Nasal group of facial muscles. Nose exhibits less mobility as compared to eyelids and lips. There are four muscles present in the nose. First is compressor nares, also known as the transverse part of nasalis. Compressor nares takes origin from the maxilla just lateral to the nose. An insertion is in the aponeurosis on the dorsum of the nose, where the fibers of the muscles of two sides intermingle with one another. This muscle is compressor nares. The action of compressor nares is to compress the nasal aperture. The alar part of nasalis or dilator nares. This muscle is dilator nares. The origin of dilator nares is from maxilla over the lateral incisor, here marked in blue. An insertion is in the alar cartilage of the nose. Action is dilation of the nostrils. Procerus muscle. This muscle is procerus. It takes origin from the nasal bone and the lateral nasal cartilage. Insertion is in the skin of lower forehead between the eyebrows. Action is to produce transverse wrinkles over the bridge of the nose. Depressor septi. This muscle is depressor septi. Depressor septi takes origin from maxilla over the medial incisor as marked in red. An insertion is in the nasal septum. Its action is to pull the nasal septum inferiorly. All four muscles, that is compressor nares, dilator nares, procerus and depressor septi, are supplied by branches of facial nerve. Oral depressors or muscles of the lower lip that help in depressing the lip. The muscles are depressor anguli oris, which is this, depressor labia inferioris, this muscle, and mentalis, this one. The origin of depressor anguli oris is from the oblique line of mandible. Insertion is at the corner of the mouth. Function is it draws the corner of the mouth downwards. Depressor labia inferioris. This muscle is depressor labia inferioris, which takes origin from the anterior part of the oblique line. Insertion is in the lower lip at the midline. Action is it draws the lower lip downwards. Mentalis muscle takes origin from the mandible inferior to the incisor teeth and gets inserted on the skin of the chin. Its action is it raises and protrudes lower lip and also wrinkles the skin of the chin. All the three muscles, that is depressor anguli oris, depressor labia inferioris and mentalis muscles, are supplied by branches of facial nerve. Oral levators or muscles of upper lip. These are the muscles that raise the lips. Oral levators include zygomaticus major, which is this, and zygomaticus minor, which is just medial to it. This is levator labii superioris and levator labii superioris alecanisi. And the fifth muscle is levator anguli oris. So these five muscles are the oral levators. Zygomaticus major and minor take origin from the lateral surface of the zygomatic bone. This is the origin of zygomaticus major, this is of zygomaticus minor. The insertion of zygomaticus major is into the skin of the corner of the mouth, and insertion of zygomaticus minor is in the upper lip, medial to the corner of the mouth. Both these muscles draw the upper lip upwards. Zygomaticus major draws the corner of the mouth upwards and the zygomaticus minor draws the upper lip upwards. This movement takes place as in smiling and laughing, and that is why zygomaticus major and minor are also known as the muscles of laughter or smiling. The other three levators, that is levator labii superioris, levator labii superioris alecanisi and levator anguli oris, all three takes origin from the maxilla. Origin of levator labii superioris is from the infraorbital margin of maxilla, and the insertion is in the skin of the upper lip. Levator labii superioris alekinezi takes origin from the frontal process of maxilla. An insertion is in the upper lip medial to levator labii superioris, and it also takes insertion in the alar cartilage of the nose. Both these muscles help in raising the upper lip. Levator anguli oris is present deeper to these muscles and takes origin from maxilla below the infraorbital foramen. This is the infraorbital foramen, and below it is the origin of levator anguli oris, which gets inserted in the skin of the corner of the mouth. It helps in raising the corner of the mouth. All these muscles, that is zygomaticus major, minor, levator labii superioris, levator labii superioris alekinezi, and levator anguli oris, are all supplied by branches of facial nerve. Other than the elevators and depressor of the lips, there are some more muscles in the lip, and that includes orbicularis oris, which is this, an elliptical shaped muscle around the mouth, and risorius, which is this. Orbicularis oris takes origin from the maxilla and mandible in the midline. It also takes origin from the fibers of other muscles in the area. The fibers run in an ellipse around the mouth. The action of orbicularis oris is to close the lips and protrude them, just like in pouting. Risorius muscle takes origin from fascia over the masseter muscle. The fibers get inserted in the skin at the corner of the mouth. The action of risorius is to retract the corners of the mouth, as in grinning. Both the muscles, just like other muscles of the face, are supplied by branches of facial nerve. Apart from the muscles of the upper and the lower lip, there is present yet another muscle in the cheek region which is called buccinator. Buccinator muscle forms the muscular component of the cheek. Buccinator muscle is present deeper to the muscles of the upper and the lower lip. Buccinator muscle has three sets of fibers: the upper fibers, the middle fibers, and the lower fibers. The upper fibers take origin from maxilla in the region of the molar teeth. The fibers pass straight into the upper lip. The lower fibers take origin from the mandible in the region of the molar teeth. The fibers pass straight into the lower lip. The middle fibers take origin from pterygomandibular raphe. Pterygomandibular raphe is a tendinous band which is present between the pterygoid hamillus above and mandible below. The upper part of the middle fibers decussate and go into the lower lip, and the lower part of the middle fibers cross over and go into the upper lip. Hence, crossing over of the middle fibers takes place so that the uppermost part of the middle fibers goes into the lower lip and lowermost part of the middle fibers goes into the upper lip. No decussation of fibers takes place in the uppermost fibers and the lowermost fibers, which pass straight into the upper and lower lips respectively. Function of buccinator muscle. When the buccinator muscle contracts, it makes the cheeks taut and presses the cheek against the teeth. This helps in chewing of the food as it pushes the food out of the vestibule of the mouth onto the chewing surface of the teeth. Buccinator muscle also helps in forceful expulsion of air from the cheeks as during whistling or blowing off a balloon. Other muscles of the face include the muscles of the ear. There are three muscles of the ear and they are the anterior auricular, superior auricular and posterior auricular. Anterior auricular takes origin from the anterior part of the temporal fascia and gets inserted into the helix of the ear. The superior auricular takes origin from the epicranial aponeurosis and gets inserted in the upper part of the auricle. Posterior auricular takes origin from the mastoid process of the temporal bone and get inserted in the convexity of the ear at the back. Anterior auricular draws the ear forwards. Superior auricular elevates the ear. Posterior auricular draws the ear backwards. Skeletal muscle fibers present in each of these three auricular muscles are very few, and thus they do not bring about much mobility of the ear. Frontal belly of occipitofrontalis muscle is a muscle of the scalp. Origin of frontal belly is from the skin of the eyebrows and it gets inserted in Galea aponeurotica. The action of the muscle is to raise the eyebrows and wrinkle the forehead. It produces horizontal wrinkles on the forehead. All these four muscles, that is anterior, superior and posterior auricular muscles and frontal belly of occipitofrontalis are supplied by branches of facial nerve. Modulus. Modulus is a fibromuscular mass. It feels like a nodule and can be palpated just lateral to the angle of the mouth. This nodule is formed by various muscles of upper and lower lip that converge on it. These muscles are zygomaticus major and minor, levator anguli oris, depressor anguli oris, orbicularis oris. All these muscles converge here and decussate at this point to form this nodular mass. The function of modulus is, since all the muscles converge on it, so it helps in carrying out the activity of these muscles in a coordinated and controlled manner. This helps to perform various movements that are required at the time of chewing, drinking, speech, and modulation of musical tones. Complete and removable dentures must be designed in such a manner to allow the modulus to function freely, or else it will lead to instability of dentures of the lower jaw. Platysma. Platysma is the muscle of the neck. It is a large thin sheet of muscle present in the superficial fascia of the neck. It is also considered as a remnant of pedunculus carnosus. It arises below the clavicle in the upper part of the thorax. It ascends through the neck and get inserted in the mandible. The medial fibers get inserted in the mandible while the lateral fibers continue upwards as muscle rhizorius and gets inserted at the angle of the mouth. Platysma muscle helps to tense the skin of the neck. The muscles of the face are also known as muscles of facial expression. Facial expression is not the primary function of the muscles of the face. The primary function is to regulate the openings on the face, that is, the oral opening, orbital opening, nasal opening. However, muscles of the face contribute to the facial expressions as they get inserted into the skin of the face and can move it to bring about these expressions. Some of the expressions brought about by various muscles of the face are frowning, brought about by corrugator supercilii. Laughing and smiling is by zygomaticus major and minor. Sadness, or moving the corners of the lip downwards, is by depressor anguli oris. Anger is by dilator nares and depressor septi. The expression of grinning is brought about by risorius muscle, and whistling is by buccinator muscle. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Innervation of the face. Sensory innervation of face. General sensations, that is touch, temperature and pain, from the face is carried by branches of trigeminal nerve, which is the fifth cranial nerve. Motor innervation of face, that is, the muscles of the face are supplied by branches of facial nerve, which is the seventh cranial nerve. Motor innervation of face. The muscles of the face are supplied by facial nerve. Facial nerve is the seventh cranial nerve. The muscles of the face are derived from the second pharyngeal arch. The nerve of the second pharyngeal arch is facial nerve. So the muscles of the face are supplied by facial nerve. Facial nerve exits the brainstem and enters the posterior cranial fossa. It exits the posterior cranial fossa by passing through internal acoustic meatus. After passing through internal acoustic meatus, facial nerve travels in the facial canal in the petrous part of the temporal bone. The facial nerve exits the petrous part of temporal bone by passing through stylomastoid foramen. After exiting through the stylomastoid foramen, facial nerve gives two branches, the posterior auricular branch and nerve to the posterior belly of digastric. The posterior auricular branch further gives two branches. One branch supplies the occipital belly of occipitofrontalis and the other supplies the posterior auricular muscle of the ear. Nerve to posterior belly of digastric also supplies two muscles. It supplies the posterior belly of digastric and stylohyoid muscle. After that, the facial nerve further travels forwards and enters the substance of the parotid gland. Within the parotid gland, the facial nerve divides into two, that is, the upper temporofacial branch and the lower cervicofacial branch. These two branches further divides into five terminal branches of facial nerve, and they are temporal, zygomatic, buccal, marginal mandibular, and cervical. These branches of facial nerve then exits the parotid gland. The temporal branch exits from its superior border. Zygomatic, buccal, and marginal mandibular branches exits the parotid gland from its anterior border, and the cervical branch exits close to the apex. Each of these branches then supply the muscles of the face. Temporal branch supplies the muscles in the temple, forehead, and the supraorbital area. It supplies frontal belly of occipito frontalis, orbicularis oculi, etc. The zygomatic branch supplies the muscles in the infraorbital area, lateral nasal area, and the upper lip. Zygomatic branch supplies the oral elevators, lower part of the orbicularis oculi, and some of the muscles of the nose. Buccal branch supplies the muscles of the cheek, upper lip, and the corner of the mouth. It contributes to the nerve supply of buccinator muscle and some of the oral levators. Marginal mandibula supplies the muscles of the lower lip and chin, that is, the depressors and mentalis muscle. Cervical branch supplies platysma muscle. Clinical anatomy of facial nerve. Bell's palsy. Bell's palsy is a condition where patient has ipsilateral loss of motor function of the face. Ipsilateral means on the same side. The cause of Bell's palsy is lesions of the facial nerve. The most common cause for the lesion is viral inflammation of the nerve within the bony canal before it exits through the stylomastoid foramen. Other causes for the lesions can be injury to the facial nerve. The lesion of the facial nerve results in paralysis of the muscles on the same side as the lesion. In this case, patient on left side is suffering from Bell's palsy. The clinical features of Bell's palsy are loss of wrinkles on the forehead. This is due to paralysis of frontalis muscle. There is widening of the palpebral fissure and inability to close the eyes. This is due to paralysis of orbicularis oculi muscle. There is inability of the mouth to move upwards and laterally during laughing and smiling due to paralysis of zygomaticus major, zygomaticus minor, and other oral levators. There is a loss of nasolabial furrow on the affected side. Accumulation of food in the vestibule of the mouth is seen during chewing. This is due to paralysis of buccinator muscle. There is a constant dribbling of saliva from the corner of the mouth on the affected side. Sensory innervation of face. The general sensory nerve supply to the skin of the face, that is sensations of touch, temperature and pain, are carried by trigeminal nerve. Trigeminal nerve supplies the skin of the face via its three subdivisions, and they are ophthalmic, maxillary and mandibular nerves. All these three subdivisions are given off by the trigeminal nerve within the cranial cavity. Each of these branches, that is ophthalmic, maxillary and mandibular nerves, exits the cranial cavity through a separate opening. These three nerves innervate the skin of the face, except for a small region over the angle of the mandible. This region over the angle of the mandible is innervated by branches of cervical nerves. The ophthalmic nerve exits the cranial cavity by passing through superior orbital fissure. After passing through superior orbital fissure, the ophthalmic nerve enters the orbital cavity. In the orbital cavity, the ophthalmic nerve gives several branches. Out of its branches, 5 nerves appear on the face and supplies the skin of the face. The 5 branches of ophthalmic nerve on the face are supratrochlear, supraorbital, lacrimal, infratrochlear, and external nasal. Supratrochlear is the nerve which is present close to the midline in the forehead and supplies the median region of the forehead. Supraorbital is present more lateral to supratrochlear and is a much larger nerve. It supplies the skin of the forehead and the skin of the scalp. Lacrimal nerve supplies the lateral half of the upper eyelid. Infratrochlear supplies medial half of the lower eyelid and side of the nose. External nasal supplies the anterior part of the nose. So, through these five branches, the ophthalmic nerve supplies the skin of the nose, medial part of the skin of the lower eyelid, skin of the upper eyelid, skin of the forehead, and the anterior part of the scalp. Maxillary nerve. Maxillary nerve passes through foramen rotundum to enter the pterygopalatine fossa. In pterygopalatine fossa, maxillary nerve gives several branches. Out of that, three appear on the face and innervate the skin of the face. The three branches of maxillary nerve on face are zygomaticotemporal, zygomaticofacial, and infraorbital. This is zygomaticotemporal, zygomaticofacial, and infraorbital. Zygomaticotemporal appears on the face by passing through zygomaticotemporal foramen and supplies the skin over the area of the anterior part of the temple. Zygomaticofacial passes through the zygomaticofacial foramen to appear on the face and supplies the skin of the face over the zygomatic bone. Infraorbital nerve passes through infraorbital foramen to come out on the face. On the face, the infraorbital nerve divides into three nerves, and they are the nasal, the labial, and the palpebral branches. Through these three branches, the infraorbital nerve supplies the skin of the lower eyelid, skin of the nose, skin of the upper lip, and the cheek. Mandibular nerve. Mandibular nerve exits the cranial cavity by passing through foramen ovale to enter the infratemporal fossa. In the infratemporal fossa, mandibular nerve gives several branches. Out of that, three branches appear on the face to supply the skin of the face. Those three nerves are auriculotemporal nerve, buccal nerve, and mental nerve. This is auriculotemporal, this is buccal, and this is mental. Auriculotemporal nerve enters the face by passing posterior to the temporomandibular joint, and it supplies the skin of the external acoustic meatus, tympanic membrane or the eardrum, and the greater region of the skin of the temple. The buccal nerve passes over the buccinator muscle and supplies the skin of the cheek. Mental nerve comes out on the face by passing through mental foramen and supplies the skin of the chin and the lower lip. Dermatomes of the face. Dermatome is an area of skin which is supplied by a single nerve. Let us try to understand what are dermatomes. The area marked in blue is supplied by first thoracic nerve, and so it is the dermatome of the first thoracic nerve. Area marked in red is supplied by the second thoracic nerve, and so it is the dermatome of the second thoracic nerve. In face, the area marked in green is supplied by ophthalmic division of trigeminal nerve. It is the dermatome of ophthalmic nerve. The area marked in blue is supplied by maxillary division of trigeminal nerve, and it is the dermatome of maxillary nerve. The area marked in orange is supplied by mandibular division of trigeminal nerve, and it is the dermatome of mandibular nerve. When viewed anteriorly, this is how the dermatomes appear. This T-shaped zone is the dermatome of ophthalmic nerve. This is the area which is a dermatome of maxillary nerve, and this area is the dermatome of mandibular nerve. The dermatome of the ophthalmic nerve is supplied by supratrochlear, supraorbital, lacrimal nerve, infratrochlear, and external nasal nerve. Through these five nerves, the area supplied is forehead region, upper eyelid, and the anterior part of the nose. The dermatome of the maxillary nerve is supplied by zygomaticotemporal, zygomaticofacial, and infraorbital nerve. Through these three branches of maxillary nerve, the area supplied is the anterior part of temple region, skin over the zygomatic bone, lower eyelid, lateral part of the nose, cheek, and upper lips. This is the dermatome of mandibular nerve, which is supplied through three nerves: auriculotemporal nerve, buccal nerve, and mental nerve. And through these three nerves, the area supplied is skin of the temple, skin of the ear, skin of the lower jaw, skin of the lower lip, and chin. So, the dermatomes of the face are innervated by trigeminal nerve through its three subdivisions: ophthalmic, maxillary, and mandibular nerves. Clinical anatomy of sensory nerve supply of face. Trigeminal neuralgia or tic douloureux. Trigeminal neuralgia is a complex sensory disorder of the sensory root of trigeminal nerve. It is associated with pain in the region of mandibular nerve, maxillary nerve, or both. The pain has a sudden onset and is of excruciating in nature, severe pain with sudden onset, and is usually associated with a triggering factor such as touching, shaving, or blowing of air on the sensitive region of the skin. The etiology or the cause of trigeminal neuralgia is not known. In treatment, the first line of treatment is giving medications. However, even after medications, if pain continues to be very severe and starts affecting day-to-day routine, then surgical exploration may be required. However, that is also not without risk. Blood vessels of the face. The arterial blood supply to the face is by the branches of external carotid artery. Limited arterial blood supply is by branches of internal carotid artery. Venous drainage from the face is into internal jugular vein. However, due to deeper connections of the veins of the face, some of the blood may return through a clinically relevant intracranial pathway involving cavernous sinus. Arterial blood supply to the face is primarily by facial artery. Facial artery is a branch of external carotid artery. Blood to the face is also supplied by superficial temporal and maxillary arteries, both of which are branches of external carotid artery. Few branches of ophthalmic artery, which is a branch of internal carotid artery, supplies blood to the forehead region of the face. Facial artery. This is the facial artery, which is the main source of blood to the face. The artery here is common carotid artery, which divides into internal carotid artery and external carotid artery. Facial artery arises as a branch of the external carotid artery. It passes through the structures in the neck to reach the submandibular salivary gland. It forms an S-shaped curve around the submandibular salivary gland to reach the lower border of the mandible. It curves around the lower border of mandible to enter the face at the anteroinferior angle of the masseter muscle. This is the masseter muscle, and this is its anteroinferior angle. Facial artery enters the face at the anteroinferior angle of the masseter, where its pulsations can be felt. As the facial artery passes upwards, it follows a tortuous course. This tortuous course helps facial artery to accommodate the movement of the lower jaw, so that even during the wide opening of the mouth, no damage to the facial artery takes place. Facial artery passes upwards, lateral to the corner of the mouth, and then lateral to the nose to reach the medial angle of the eye. As the facial artery passes upwards in the face, some structures are superficial to it and some others are deep to it. Structures superficial to facial artery are platysma muscle, rhizorius muscle, zygomaticus major and minor. Structures which are deep to the facial artery are buccinator muscle, levator anguli oris, and levator labii superioris. As the facial artery passes upwards in the face, it gives some branches in the face. They are inferior labial, which supplies the lower lip, superior labial, which supplies the upper lip and the septum of the nose, lateral nasal, which supplies the nasal surface and the dorsum of the nose, and its terminal branch is the angular artery, which supplies the medial corner of the eye. Near the midline, the arteries of the two sides anastomose with each other. That is, superior labial artery of right and left side will anastomose with each other in the midline. This provides an important connection between the facial arteries of the right and the left side, and thus the external carotid arteries of the two sides. Transverse facial artery. This is the transverse facial artery which too contributes blood to the lateral side of the face. Transverse facial artery is a branch of superficial temporal artery. Superficial temporal artery is one of the two terminal branches of external carotid artery. This is the external carotid artery, and in the substance of the parotid gland it terminates by dividing into maxillary artery and superficial temporal artery. Of the two, the superficial temporal artery is smaller, and superficial temporal artery gives rise to transverse facial artery, which travels transversely in the face between the zygomatic arch and the parotid duct. It supplies blood to the lateral aspect of the face. Maxillary artery is the larger of the two terminal branches of the external carotid artery. Maxillary artery gives several branches. Three of the branches of maxillary artery appear on the face, and they are infraorbital, buccal artery, and mental artery. Infraorbital artery enters the face through the infraorbital foramen and supplies blood to the region of lower eyelid and upper lip. Buccal artery is present on superficial surface of buccinator muscle and supplies blood to that area. Mental artery enters the face through mental foramen and supplies blood to the chin and the lower lip. The fourth artery which supplies blood to the face is ophthalmic artery. Ophthalmic artery is a branch of internal carotid artery. Ophthalmic artery supplies blood to the face through its four branches, and they are supraorbital, supratrochlear, zygomaticofacial, and dorsal nasal. Supraorbital and supratrochlear supplies blood to the forehead. Zygomaticofacial supplies blood to the area of face over the zygomatic bone, and dorsal nasal supplies blood to the dorsum of the nose. Veins of the face. Facial vein. Facial vein is the major vein draining blood from the face. It begins at the medial angle of the eye. It is formed by joining of supratrochlear and supraorbital veins at the medial angle of the eye to form angular vein. Angular vein descends down in the face as the facial vein. As the facial vein descends down in the face, it receives the following tributaries: the lateral nasal, superior labial, and inferior labial. The facial vein reaches the lower border of the mandible, where it passes superficial to submandibular salivary gland. Facial vein is then joined by the anterior division of retromandibular vein to form common facial vein, and common facial vein terminates by draining into internal jugular vein. Facial vein during its course drains blood from most of the face, including areas like eyelids, external nose, lips, cheek, and chin. Transverse facial vein. Transverse facial vein accompanies the transverse facial artery. It drains blood from the lateral part of the face. It drains blood from the area of the face which is supplied by transverse facial artery. After draining blood from the area of the face, it terminates by draining into superficial temporal vein. Superficial temporal vein passes down into the parotid gland where it is joined by maxillary vein to form retromandibular vein. Retromandibular vein then divides into anterior and posterior subdivisions. Intracranial venous connections. This is the facial vein which drains blood from the face. This is cavernous sinus, which is an intracranial dural venous sinus. Intracranial dural venous sinuses drain blood from the cranial cavity, including the brain. Facial vein has connections with the intracranial veins. These communications of the facial vein with the intracranial veins include ophthalmic veins. This is the superior ophthalmic vein and this is the inferior ophthalmic vein through which the facial vein establishes communications with the cavernous sinus. This is the infraorbital vein. And these are the deep facial veins through which the facial vein is either directly connected to the cavernous sinus or it is connected to the pterygoid plexus of veins and then pterygoid plexus of veins is connected to the cavernous sinus. So through these communications of the facial vein, that is the ophthalmic veins, infraorbital veins and deep facial veins, the facial vein communicates with the cavernous sinus either directly or indirectly. All these communications are valveless channels. So the blood can flow in either direction. That is, it can flow from the facial vein into the intracranial veins or from the intracranial veins into the facial vein. Because of the valveless deep communications of the facial vein with the intracranial venous sinuses such as cavernous sinus, infections from the face can travel in the retrograde direction, infecting the intracranial veins. The triangular area of the face, which includes the nose and the upper lip, is called the dangerous area of the face. This is so because the infections from this area can easily travel in the retrograde direction through the deep facial veins, infecting the cavernous sinus. This can lead to cavernous sinus thrombosis. Cavernous sinus thrombosis is associated with unilateral periorbital edema, headache, photophobia, bulging of the eyes, ptosis, that is drooping of the eyelids, chemosis, and cranial nerve palsies. Infections transmitted inside the cranial cavity can also result in temporary or permanent damage to the brain. Lymphatic drainage of the face. The interstitial fluid in the face enters the lymphatic vessels. The lymph traveling in the lymphatic vessels pass through one of the three group of lymph nodes that drain the lymph from the face. They are submental group of lymph nodes, submandibular group of lymph nodes, and parotid group of lymph nodes. Submental group of lymph node is present below and behind the chin. The submandibular group of lymph node is present superficial to the submandibular gland just below the lower border of mandible. Preauricular or parotid group of lymph nodes is present superficial to the parotid gland just in front of the ear. Submental group of lymph nodes is also known as lower territory lymph nodes that drain lymph from the lower lip and chin. Submandibular group of lymph nodes is known as the middle territory lymph nodes that drain lymph from the middle part of the forehead, medial corner of the eye, nose, medial part of the cheek, upper lip, and the lateral part of the lower lip. The parotid or preauricular group of lymph nodes comprise of upper territory group of lymph nodes which drain lymph from the major part of the forehead, lateral part of the eye, lateral part of the cheek, and from the parotid area. The lymphatics from all these three group of lymph nodes will ultimately drain into deep cervical group of lymph nodes. Some of the frequently asked questions in the examination from the topic face are: enumerate the muscles of the face, briefly describe the muscles, buccinator, zygomaticus major and minor, orbicularis aureus, orbicularis oculi, levators of the lip, depressors of the lip. All these muscles must be covered under the following subheads: origin, insertion, nerve supply, action, and important relations. Blood supply of the face, which will include both the arterial supply as well as the venous drainage. Sometimes only the arterial supply may be asked. Sensory innervation of the scalp or dermatomes of the face. Motor nerve supply of the face. Lymphatic drainage of the face. Some of the questions from clinical anatomy may include: which is the dangerous area of the face and why? Write a short note on Bell's palsy. Write a short note on trigeminal neuralgia.